left the pen. Okay. Hello, everybody. Thanks for being here. Let's go through some of the data, and then we'll take some questions. Unfortunately, we lost 2 residents of the community over the last 24 hours. 85-year-old male who died in a hospital from a congregate care facility, and then a resident of a senior congregate care facility as well. So certainly want to keep them in our thoughts and prayers, and all of the loved ones and everybody we've lost during the pandemic. We've now lost 651 people in the pandemic since March 16th when it hit our community. Related to our 7-day average from a positivity rate, it is down a little bit today, down to 1.4%. I think today will actually be the first day in a while where our actual single-day positive rate is under 1. That's very good. There's increased testing in the community related to having colleges back in town, so that certainly helps with some of the testing numbers on certain days. Looks like today was probably one of those days. We've now had 30,891 positive cases since March 16th. That's 61 new cases. Usually our busy days are Thursday, Friday, and Saturday. So today, Thursday, 61 is a good number for a Thursday, in my opinion. And we've been doing this a little while, so I think my opinion is pretty good on that. Active cases, 839. I think we got down into the 700s last week. Looks like we might have an opportunity to get there again if we continue on the right trajectory. And out of our 61 cases, there was 1 case out of a senior facility. So certainly we credit a lot of that to the vaccinations that have happened within those buildings. So that's good news. There's been, unfortunately, the reality of with this virus is it preys on those buildings. There is a direct pipeline with positive cases from senior facilities to the hospitals to the ICU room. So certainly the downward trend in cases there is really welcome news. Hospitalizations, we have 85 of our residents in the hospital right now related to COVID. That's down a little bit. We have 12 of our residents in the ICU room. I think that was where we were yesterday, or pretty close to it. So certainly please keep these 12 people in your thoughts and prayers as they're having a very difficult time. We need them to get well. Looking at the vaccine, today we are in the process of finishing a pop-up clinic over at the Shonard Street Boys and Girls Club in the near west side. These pop-up clinics we work with in partnership with New York State. They give us the vaccine in addition to what our weekly allotments are. We then work within communities that we know we're running behind. There's a couple things that we know from this process is that the mega site at the fairgrounds, which has been an asset for the community, we help staff that site. We also know that many of our minority communities are not utilizing that site. That's a fact. So we need to intentionally get into our communities within the city of Syracuse, our African-American communities, our new American communities, our Latino and Hispanic communities, intentionally to go there so we get better participation within the vaccination process. We've been doing that and we'll continue to do that. So that is something today, small pop-up clinic, but a very successful one. Tomorrow we will be having our first, not our first clinic, but a clinic where we're focusing in on our residents with comorbidities with our primary care networks, working with Dr. Gupta and their team, and members of our developmentally disabled community. So that will be our clinic tomorrow. Today we also did some second shots here as well. To date, going into today, at our clinic, our county pod, we have done 20,532 first doses and 12,711 second doses. I'll get into some more vaccine information in a moment. But just moving forward, part of our why I think if you look at our data overall, why we've had a lot of success, specifically after the Thanksgiving surge, was really our testing strategy and really going out into the community. I want to remind people that my biggest concern moving forward with upticks is symptomatic spread. We saw this happen towards the end of the fall before Halloween. We saw upticks. They were small compared to what we saw, but a lot of that was symptomatic spread. So please, symptomatic testing at the regional market, Monday through Friday, 9 to 2. Weekends at Essentia Health on West Genesee Street, 1050 West Genesee Street, 8 to noon. ongov.net/Cayuga Medical. Please take advantage of this testing. If you are sick, any symptoms related to COVID, we all know what they all are now. Please go get a test. Let's rule out COVID so we can continue to get these numbers going in the direction they're going, and we can continue to take back different elements of our lives, whether it's the social fabric of our community or the economy, which has been both have been strained over the last year, to say the least. Asymptomatic testing. Today we are at Onondaga Town Hall, and tomorrow we will be at the Lafayette Community Center. Again, you can go to ongov.net if you're down in the southern towns or are going to be there. I think there's probably still appointments available. Please take a look at that. On vaccination data going into today for Onondaga County totally. So our total number going into today was 74,552 first shots. So what does that mean? That could mean you go to the fairgrounds. It means you can be going to the drugstores, to our pod. It could mean you go to another state site. You could be going up 81 to Potsdam. You would be in this number. This number is 16.1% of our population, which is, I believe, the highest out of the big counties, the big six they call us, in New York State. When you look at our adult population who's eligible right now, remember, children under 16 for the Pfizer shot are not eligible. Children under 18 for the Moderna shot are not eligible. So when we look at the 360,000 adults in our community, not all of them are eligible to get a shot yet, but out of the 360,000, 74,552, that's 20.7% of that number has been vaccinated with first shots. So we're making progress each week. I know that it's frustrating for those who try to get appointments and can't. It is getting better, and it will continue to get better each week as there is upward movement in supply for that. Out of our pod, I have some age. I'll give age breakdowns right now out of our pod of who's gotten shots. Tomorrow we can release the race data once we have it finalized from our pod today. But I do have basic age and geographic breakdown. So age out of our pod, 35% have been over 65, 48% between 35 and 64, and 17% under 34. When we look at the residency, when we look at the county, 20% of our doses in our pod have been from the city of Syracuse. 68% have been from the rest of the towns, 8% out of the county, 4% under the unknown or did not mark there. So we'll be able to figure out that 4%. But when you look at it, so 92% countywide participation at our pod. We always knew we would be vaccinating some from other parts in the beginning part of this process. Remember, we were getting vaccine redirected to us from the hospitals, so we were vaccinating their employees. And certainly, if you live in Madison County and teach in Onondaga County, we want you vaccinated. And so Central New York's really teamed up together well. So overall, good numbers there from 92% of our pod being county residents. We are getting more data now. We've been in this vaccination process for a while. We are getting zip code data, and we're analyzing this data to look at different gaps. We know the city of Syracuse is lagging overall when we look at the 74,000 shots to date. We're going to work with the state of New York and look on some further strategies to address that. Next week, we may do a small pop-up clinic in the rural communities. Some of the rural zip codes are lagging some of the other suburban zip codes. So we'll certainly try to be intentional potentially next week as well with that. So more to come on that on Monday. But as we get more vaccine in the community and we see what the trends are, we'll pivot to try to address those trends the best we can with the supply that we have. Another item that has been talked about quite a bit is school, back to school. The back to school means different things depending on what part of the country you're in. There's a lot of talk about guidance that's come out from the CDC this week. There's parts of this country that kids literally just haven't gone back to school. And so in our state, we've had kids going to school. The challenge is based off of the district, we've had folks going to school every day in some districts. We've had hybrid models that are stronger in-person hybrid models, and in-person learning we know is best for the kids and for the adults. And then there's some districts that the models are hybrid, remote driven, and we know that that's a challenge for both the educators and for the students. So we're looking at those. We have received guidance from the state of New York that the 6 feet to 3 feet with desks in a classroom is a local health department decision. Why is that important? Some of the conversations with superintendents around this issue is kind of like as follows. If you change the 6 feet rule and it was only 3 feet with the distancing with desks, or something 4 feet, we could then bring back more in-person learning because of the physical space. So our health department will review the latest guidance. We'll continue to review the data. We've been data-driven this whole process. We don't get pushed around. The data showed very clearly that we could adjust our quarantine guidance. We did that, and that will be less disruptive to kids in quarantines in school, less disruptive to teachers, which will help keep the school process going through. Another bright spot with this is that we've been working with both school districts and teachers unions related to vaccinating the staff. We are very close in many of the districts to have vaccinated all of their staff, at least with the first shot. And so this will also be a great tool. So we are going to continue to try to get all the first shots done with our educators so that that's done. This will build more confidence with the workforce. We'll continue to review all the data. Dr. Gupta will make a call on if we can go to 3 feet, and then that may change some of these hybrid models. But I do believe in in-person learning, but we're going to let the data drive the decision, not the politician drive the decision. Coming back from winter break, we are going to be next week. We're going to be doing a lot of school-based testing in the schools, partnering with many of these districts. One of the risks are we don't know how many people are traveling this week. Coming back, we're making a lot of progress. If people are coming back or kids are coming back from Florida, other southern states, we want to find any pockets of the virus right away. recognizing we probably will if people are traveling into parts of the country that have higher positivity rates. Some of them will bring it back. And so our job is to try to go find it. And their job and their responsibility is to follow quarantine rules and test out of quarantine. And everybody's job in this community is, if you're symptomatic, you need to get a test and rule out COVID. If we all do our jobs in this, even if we get a small bump in cases from winter break, we'll quickly nip it. So we will be working with districts next week as well, testing actively in the schools. There was a little bit of confusion for some parents and some districts related to a memo from State Education Department. They clarified this memo. The memo read originally, that came out last week, that we could not test for athletics, for local health departments could not. They revised that. Local health departments can test for winter sports and for athletics. That's our rule. Why do we do that? Because we don't need situations where we allow athletics and then we have an event, we have a game, and next thing you know, we have 20 positive cases from a game. Our rule has already worked. We've already had situations where student athletes were positive, and we found that because of our testing program. That saved other cases. So the rule works. Clarification was there. I know some parents were sending us correspondence suggesting that we didn't have the authority. We do have the authority. It was clarified. We have the program in place, and it's working well. And because of that, the season will not be jeopardized, because we will find the virus, and if it's there, we will prevent those teams from participating. They'll do their quarantine. They won't be passing along the virus to other teams so that their seasons won't be disrupted. So that's kind of my school update. Saying that, happy to take questions. Yes, sir.
So, Syracuse University Chancellor Ken Server sent out an email yesterday saying that the university is approaching a threshold of 100 cases. How concerning is it to see the county numbers going down, but Syracuse University's numbers going up?
Yeah, so it's actually kind of a good sign in a way that we're taking a bump of college cases, yet we're still trending lower. I think one of the things that's unfair to Syracuse University and Cornell and some of the larger universities is 100 cases in 2 weeks is not a lot of cases. We do that in 2 days, right? And I think it should be based off positivity rate, not cases for the larger schools. If you have 1,000 students and 200 faculty, 1,200 campus, smaller school, and you have 100 cases in 2 weeks, that's a different ballgame, right? So I think the existing rule is problematic for larger institutions. It always has been. The margin of error is so small. And if your positivity rate on campus is lower than the community at large, I still think you should be able to do in-person learning. Saying that, I don't make that rule, but I'm expressing you my opinion. So that's the challenge. That's why these students at SU need to be better, really, than their peers across the state to keep in-person learning going. And so I'm sympathetic, because I think if you do look at their positivity rate, with all the testing they're doing and the number of cases, they're under 1%. There's no question. So to be under 1%, which is, if they were their own state, would be the best state in the country, yet they have to shut down because of this rule for in-person learning, to me it seems punitive. If their positivity rate was 8% and you had 100 cases, that's different. So I think the kids got to be smart. This is an experience that you only get once in your lifetime. Let's be smart. Hopefully we continue to get everybody vaccinated, and in the springtime, maybe you get some of your college experience back. But we're not there yet.
And speaking of that college experience, how close, if at all, is Onondaga County and Syracuse University to letting fans or students back into the dome for athletic events?
Yeah, I think they're good to go. I think on the North Carolina game there, not this weekend. I think next weekend they might. I would have to look at the guidance that came out from the state uh, if they were allowed to have people at the game this weekend. I know there was a date. I don't know if they're ready for that, but I do know that the conversations I've had is that North Carolina men's basketball game was a date they were looking to try to get students into that game. They can do the testing and meet that requirement. Um, all of my conversations have been that the public at large, they would try to build up their systems and focus more in on lacrosse for that. But again, that will be the university's call. They have the systems in place, the tools in place with all the testing that they do, that they'll be able to pull off whatever they choose to.
Last question. Are you at all looking to partner with Syracuse University to exclusively distribute the vaccine to only the university community?
Will when the supply becomes to the point where you see younger people becoming eligible, certainly it would make sense for us to have a vaccination site there, just like it would at Lemoyne and the other colleges. I think we'll get there probably late spring as far as that eligibility standpoint goes for our young people. Certainly the data shows that the young people do get this virus, but they have better outcomes with this virus than those who are not as young. Yep.
Speaking of higher education, just kind of jumping off that, do you know how many of the county's daily COVID cases come from Syracuse University?
Yeah, I think the website updates them for higher ed. I think yesterday there was 73 cases. I think 7 out of the 73 were reported being Syracuse University. I don't have that number out of my 61 today. It's again the trend hasn't been these cases are being driven by colleges. There was 3 or 4 days where I think the cases did have, there were significant cases out of Syracuse University last week, but I don't. My guess is, and again, the data on the website will show, but my guess is out of the 61, there's probably not more than a handful of cases out of that 61.
Ryan, you and other county executives had a call with Senator Schumer today. What did you guys talk about, and anything promising coming from that call?
Yeah, Senator Schumer, first off, has been a tremendous advocate for counties. He knows what we do. He knows the role we play. He knows that we've been the ones on the front line doing the work, and he wants to get direct funding to us. It's a model that's tough for the federal government to do because there's different layers of local government in different states. There's towns, villages, cities, and counties in New York. There's townships and parishes and others, and they all kind of do the same thing, but some do different things. So it's tough from the federal level to get money directly to locals. And so what they usually do is they go to states. The challenge there is if you want the money going to the front lines, the best way to guarantee it goes there is you give the money to the local governments because we are the front lines. So the senator has been a tremendous supporter. He's now the majority leader in the Senate, very powerful position, and we're going to get some direct aid. Some of the House has a bill they're pushing through now. The Senate and House have been working on it. It looks like there's enough support through at least a reconciliation process for state and locals that formula will probably stay intact. If it changes, it hopefully won't change much. So that's really good news to hear. And he got to hear from the different association groups that the health directors and commissioners were on the call as well. So think about Dr. Gupta and her colleagues from across the state about direct funding for local health departments for many of these initiatives. Again, the reality is if you want it to come to us, you need to give it to us, or else it might not get to us. And that happened with the CARES Act. So the senator was great. We talked about the aid. It could replace lost revenue. It could potentially go for different types of economic stimulus as well. What we're being talked about getting in county government is less than what our lost revenues have essentially been in the cuts that we've had to make. So utilizing the funding won't be a challenge.
You've only been asking for federal funding for about 10 months now. What makes you hopeful? I mean,
Well,
if the conversation you had today.
Quite frankly, he's in charge, right? So, and he knows his conference. The president has put forward a plan. The House seems likely to pass the president's plan, and the Senate's always been the question. Some of the complications when McConnell was in charge was that many of his members, their counties got direct funding from the states. So in the CARES Act, the states gave money to the locals. So the locals still haven't even spent that money in many cases. I have calls with my colleagues from across the country. They're shocked to hear that we didn't get direct funding. So that is, McConnell could always point to that. Now Senator Schumer's in charge, and his members are committed to it. There's a reconciliation process where they can fund this, even if they can't get 60 votes. So I expect that's probably what will happen.
In the past, you've said that the county can handle a lot more vaccines than we're, obviously currently being given. So I'm just curious, how many more? And then can you also kind of talk about, what the system and the process will be like of expanding infrastructure when we do get more vaccines?
Yeah, so we can do up to 18,000 in this building a week. So essentially, if you think about 9,000 first shots, 9,000 second shots. We, in anticipation, when we thought we were going to be essentially the vaccination outlet, we brought on and reached out to many part-time nurses. Now these nurses have full-time jobs, retired, and they can work various hours. So we've brought on over 100 of them, and so we have the ability to activate a shopping town. We have ability to go do one of the gaps so far has been homebound seniors. Right now, we want to get to homebound seniors, but right now there's just not enough vaccine to do it. So at some point, we're going to be able to activate that. So you need a team, right, that can go do these things. So we can activate other sites. In addition to that, we can go do strategic pop-up pods or strategic smaller sites in parts of the community at large that are not participating at the levels at the other large mass vaccination sites. So that's what we want to do. We have the ability to probably do about 36,000 shots a week with the infrastructure that we have on hand. And so, again, if we had 36,000 shots a week, we could get through this process pretty quickly.
Do you have any indication of whether your supply will go up next week and by how much?
So I think, Tim, we'll get our 1,900. Maybe it might go up a little bit, but we'll have that at least for the next few weeks. So, again, what's nice about where we're getting now, even though we had residents of the community who have comorbidities have become eligible, it's a lot of people. Right now, we have gotten some of these other groups that we've been vaccinating. We're almost to the point where we're done with those groups. And so that frees up those vaccines to go to those with comorbidities even more. And so that's good. But I'm talking to the state. There was a question, I think your outlet, Tim, talked about we didn't get a federal mass vaccination site in Onondaga County. A couple of reasons. One, our people are getting vaccinated at higher rates than anywhere else in the state for big counties. But two, we already have two large pods here with our on-center and the fairgrounds. So the state and I are having conversations about how we can get redirected supply when those federal mass vaccination sites come online. The feds are bringing that supply there, so those regions would be getting disproportionate supply. So some of that supply will get rebalanced into other regions, and then we'll focus in on some new strategies for that supply. So I do think it's going to get better in the next 2 to 3 weeks, and then at some point we're just going to get a lot of supply, and then I think you'll see the eligibility pool just open up, and then when you go online for an appointment, it's not going to be the Hunger Game dash. You'll be able to get an appointment, and we'll be able to get shots in arms and crush this virus.
but that day's not within sight yet.
No, I think everybody's waiting on the Johnson & Johnson. Johnson & Johnson, what's different compared to Pfizer and Moderna is they don't got tens of millions of vaccine already manufactured. My understanding is they do have vaccine that's already manufactured, but each state's not going to get 200,000 or 300,000 a week sent out right away. But that would be another injection into the supply chain. And because your long-term care facilities essentially are done, you still will have some employees and some residents who choose to get the vaccine later on. That supply is now becoming available. Your hospital employees are essentially done, so that supply is now available for immunocompromised and comorbidities. So it's getting better. It's not where we want it, but it is getting better, and we can feel that it's getting better based off of the pressure in the community reaching out to us as well. So we're getting there. It's a tough process. The communication could have been better from the outset, from the top level of government to manage expectations. I think part of this was you had a vaccine that was produced in record time, but expectations on supply were not managed. And because it wasn't done well from that level, that just all kind of rolled downhill. But our data is good. 74,000 residents so far, first shots. I think over 30,000 have gotten second shots as well. Tomorrow that number is going to be up probably close to another couple thousand people, and we're going to continue to make progress.
The age and geographic information breakdown you gave for the vaccines, is that for on-center only?
Yes.
It does not include your pop-up clinic?
That no, any pop-up clinic we do or the on-center. So any outside of the fairgrounds and the drugstores, any.
So even with the pop-up clinics, it's still only 20%.
Correct.
Of the city of Syracuse.
And think about where this building is. This building is in the city of Syracuse, very close to our poorest communities. And so we're a walk away from one of our poorest housing projects. It just shows you that even that location does not mean you're going to get great participation. So you have to do things differently. We're learning that. Again, even though our numbers aren't as great compared to our population, compared to other communities in New York right now, we're actually doing better. But we'll get there. We're going to get to everybody. Every day we go into a community that's hesitant with this vaccine, we develop new credible messengers. People aren't getting very sick. Some people might get flu-like symptoms. Some people won't. But those credible messengers then help us get more people to get vaccinated.
Opening day of Syracuse Mets here in Syracuse, April 13th. Will there be fans there?
I think so. We'll work with, we haven't talked to the Mets yet about what their thought process is and how their business model would work with testing, but they'll be allowed to have fans. And hopefully they'll want to. You probably remember a couple years ago, Josh, I threw out the opening pitch, and it was a strike. It was a great pitch. And so I don't know if I'll be able to throw a good one like that again, especially if I'm still seeing double. I definitely won't be able to throw out the first pitch, but that was a great pitch.
So Dr. Gupta will throw it the 13th.
We could have Dr. Gupta do it, yeah. She should. She's earned it.
Hey, this is just a rumor question. Have you guys had to waste any vaccines because people didn't show up, or?
No, my understanding is we have not. Nobody's told me that. We have whenever there's additional vaccine available, we will call public-facing employees. That's been our guidance, and so that's what we typically do. We better not have.
All the news that's been coming out of the state capitol with the Cuomo administration and from the reporting from the Post to what's come in the last couple days. Any comment on what's happened there?
Yeah, I think the transparency is the best thing for all of us in these positions. I just got asked a tough question, right? And if I knew the answer was different than what I was asked, I should tell the truth with the answer, even if it's an answer that might be tough. And that's the I understand what's going on. I think that everyone needs to be transparent. Everyone needs to answer questions. We are in the middle of a pandemic. We're in the middle of a war, if you think about it. We're making grounds, and the only way in this war that we win is if the public is behind us and they believe in what we're saying, and they can trust us. And so I think that the administration has to work with this and work with their legislative branch of government and answer the tough questions. And I think then the public and the legislature goes from there, right? In my role, when you're a legislator, I used to be a legislator, you have the ability where you don't have to govern on a day-to-day basis. You get to take votes. You get to advocate for policies. You get to kind of throw political bombs and not have any consequences. As executives, you can't do that. I have to govern. I have to manage this crisis, and I have partners in this process who I have to work with. The White House being one of them, the governor being another, and then I have my partners in the local government and all my human service agencies. So I'm not going to Monday morning quarterback the decisions that the former president made, the existing president makes, or the existing governor makes. I will encourage everybody to be transparent, answer the tough questions, no matter what the answers are, and you all in the public will judge the work that those leaders do and the work that I do. Other questions?